I'm Tim Harper, emergency room nurse and graduate student at Maryville University in St. Louis, Missouri. There is a public health emergency in the St. Louis area. Heroin and opiate overdoses have quadrupled in the last few years to epidemic proportions. 90% of all overdoses in the state of Missouri happen in the St. Louis area. In April 2012, while I was working in the emergency room, the paramedics came crashing through the doors with a young man overdosed on heroin. Although the paramedics and emergency room staff performed heroic life-saving measures, the young man died. His father stated that he used to be employed as a pharmaceutical rep for the company that made naloxone hydrochloride, also known as Narcan, the opiate overdose antidote. He said through tears, "If only I had some of that medicine, I could have saved his life." On the way out to my car that night, my phone went off with an alert about an Associated Press article headlined, "Saved by the Nose, Opiate Overdose Antidote Put in the Hands of Addicts." The article discussed programs in cities around the country that distributed opiate overdose rescue kits containing naloxone. There were programs in cities like Chicago, New York, Boston, and San Francisco. Upon further investigation, I found that in Boston, when the death rate from opiate overdoses skyrocketed to 1,600 in 1 year, the Public Health Department declared an emergency and authorized a rescue program that utilized naloxone. The death rate dropped 60%, an incredible figure. I didn't understand why St. Louis didn't have a similar program, so I traveled to the headquarters of the Harm Reduction Coalition in New York City and met with the leaders. I also met with Dan Bigg from the Chicago Recovery Alliance, one of the first programs in the country to distribute naloxone. After all this, I started believing that we really need a similar program here in Missouri. So with the help and support of many leaders from around the country and locally, the Missouri Coalition for No Opiate Deaths was born. We are currently organizing, networking, lobbying legislators, and teaching. By 2015, we hope to have a program in place that helps rescue people who are overdosing and dying by distributing naloxone opiate overdose rescue kits. This is the kit I got in New York, which contains a needleless system utilizing intranasal naloxone. It's effective, but also very simple. It just needs to be sprayed up the nose of someone who has overdosed, and the opiate's effects are immediately reversed. There are many leaders locally who are working very hard to make this happen. We are meeting and collaborating with these leaders frequently. We appreciate everyone's support in making our goals a reality.